Have you ever found yourself pulling out your hair strand by strand without even realizing it? If so, you might be experiencing trichotillomania, a type of compulsive behavior that could be challenging to understand and even harder to treat. Well, in this video, we'll be breaking down what trichotillomania is, how it's diagnosed, and the best practices for managing its symptoms. So stick around. The term trichotillomania was derived from the Greek words for hair, to pull, and madness, which essentially means hair pulling madness. This condition used to be classified in the DSM as an impulse control disorder. However, the DSM-5 changed the classification to an OCD spectrum disorder, along with other diagnoses such as hoarding, skin picking, and body dysmorphic disorder. There are two main features to watch out for when diagnosing trichotillomania. The first is recurrent hair pulling that leads to noticeable hair loss, while the second is repeated attempts to stop or reduce the hair pulling behavior. The hair pulling can occur anywhere on the body, right? But the three most common sites are the scalp, the eyebrows, and the eyelashes. And this disorder most commonly emerges in early teen years and is thought to affect approximately 1 in 60 people. Now, why does trichotillomania occur? Many experts believe that this disorder begins as a simple habit and eventually evolves into a clinical condition. So for example, you might experience a sense of satisfaction or tension relief when you randomly pull out a split end. And if this behavior is positively reinforced, you might find yourself pulling more and more hair the next time you're bored or anxious or stressed. And over time with these repeated behaviors, your brain becomes rewired so that you automatically default to hair pulling whenever you're in these emotional states. So how is trichotillomania treated? Just like most other conditions in psychiatry, therapy and medications are the two main approaches. But it's important to note that medications are not an effective standalone treatment for this disorder. While SSRIs are commonly prescribed for various other mental health conditions, two meta-analyses have found that they're no more effective than placebo in treating trichotillomania. What's interesting is that N-acetylcysteine, or NAC for short, is a natural supplement that has shown promising results in treating trichotillomania. It works by reducing the synaptic release of glutamate. And this is really interesting because glutamatergic dysfunction has been linked to OCD. And remember, trichotillomania was recently changed to be an OCD spectrum disorder. So, in the largest positive study to date on trichotillomania, researchers found that those who took NAC had significantly less hair pulling and an overall improvement of 40% compared to those who received placebo. Dosing was between 1,200 to 2,400 milligrams per day. However, when it comes down to it, more studies are needed to confirm NAC's effectiveness in treating trichotillomania. Now, given the limited effectiveness of medications in treating this disorder, what's the most effective treatment? The most well-studied and effective treatment approach is habit reversal therapy, or HRT for short. HRT has been used with great success in managing a variety of conditions, including Tourette's disorder, nail biting, and thumb sucking. What I need you to know is that habit reversal training has two main components: awareness training and response prevention. Awareness training is the first step in helping people become more conscious of their hair pulling behaviors. This involves recognizing cues or triggers that lead to hair pulling and describing the behaviors associated with it, such as where, when, how long, and how the hair was pulled. It also involves identifying warning signs and urges before pulling. After gaining awareness of hair pulling behaviors, response prevention is the next step in treating trichotillomania. This involves creating a competing response, which is a behavior that is physically incompatible with hair pulling. The competing response should make it difficult to pull hair and also provide a similar reward to the hair pulling. So for instance, someone who habitually pulls their hair with their right hand might take that hand and put it in their pocket, or make a fist and squeeze it tightly whenever they feel the urge to pull. By doing so, it becomes impossible for them to pull their hair, and it also serves as a tension release and an anxiety reducer. This approach is a key aspect of habit reversal therapy, as it helps individuals break the habit loop of hair pulling and replace it with a new, more adaptive behavior. Now, as you probably already know, finding the right therapist near you can be difficult, whether it's because of insurance difficulties or access issues. There are two websites that many of my patients find helpful that I want to share with you. www.trichstop.com offers an online therapy program that is actually therapist guided. And then www.stoppulling.com is another self-guided online program that you can check out. I put links to both of these websites in the description below. If you found this video to be helpful, make sure to give it a thumbs up and hit that subscribe button. Otherwise, click that next video for more information on mental health and wellness.